Here at the Children's Hospital in Westmead, a medical miracle has occurred. A 15-year-old girl has naturally taken on the immune system of her liver donor.
What's really unique about this is that the blood changed over. When it first brought to the vital lab staff, to my colleague, and said, this girl's blood group's gone from O negative to O positive. You know, first of all, we thought we must have made a mistake. You know, maybe we'd done the blood group wrong, so we did it again. And then we looked back and we said, no, we've done it lots of times before. She's always been O negative, so it is real. So then we went, well, how can we really confirm that? So we thought, well, we can check the parents. So we did blood group on both parents and confirmed that they were both O negative. So absolutely, Demi had to originally have been O negative because we didn't have any of her cells before the test. So we knew she was definitely O negative. So then it was like, well, she's changed the blood group, but what does this mean for Demi? And initially it didn't seem to mean very much. It was just a routine prostate. But then she came back a few months later and she started to break down her blood. And initially we didn't know why is she breaking down her blood. She swapped her blood group, but why is she breaking down her blood? And then we did a lot more tests to try and work out, well, how much of it blood is hers, original her blood, and how much is her donor's blood. And that's where Dr. Smith's lab came in, and they were actually able to show that almost all of the blood was now the donor's blood. So most of the blood being made by the bone marrow was from the donor, but there was still a little bit of the immune cells were Demi's original immune cells, and they were the cells that we could detect were causing the problem because they were making the antibody that was making her break down her blood. And there was a while there that Demi was really very sick. You know, we had her on a lot of medications trying to stop this hemolysis, and we were trying to stop her breaking down her own blood, but you know, while we were in the process of sorting it all out. And then we sort of worked out, well, okay, the problem is her own residual cells are causing the problem. We need to get rid of her own original cells. And that was a very brave step for us to take because it meant telling the liver doctors, really we think what she needs is no immunosuppression rather than more immunosuppression, which is what we've been doing. And so together we came to that conclusion that yes, maybe this is the best thing for Demi, and we wound back how much immunosuppression she was having. And over the period of time, as we started to reduce the immunosuppression, the breaking down the blood stopped. It was fantastic. Suddenly she was not breaking down her blood anymore. She was getting much better. And then all the side effects of the immunosuppression, which is the big problem for these kids once they've got their liver transplant, then they've got to keep taking immunosuppression and they all have side effects. Well, all those side effects started to go away, and over a period of time, as we've got to write off the immunosuppression, no more side effects, no more breaking down blood, no more tablets to take. The holy grail of the transplant was achieved.